If you were in an accident and felt okay at first, but then your neck pain showed up later, this is incredibly common. Let's talk about what whiplash actually is, why symptoms can be delayed, and why early imaging can look normal, and what a phased plan typically looks like. This is general education, not medical advice. If you have severe pain, major trauma, new weakness, numbness that's worsening, trouble with balance or coordination, or other urgent symptoms, seek immediate medical care. I'm Dr. Vivit at Chicago Laser Pain Center. We see a lot of people across the Chicago area after car accidents, especially rear-end collisions or sports injuries, who want a thoughtful, non-surgical path and a plan that matches where they are in their recovery process. Whiplash is basically an acceleration-deceleration event. Your body moves with the car and your head and neck lag behind. Then they rebound. That rapid back and forth motion can strain multiple tissues, muscles, ligaments, joints, and sometimes damage discs and irritate nerves. It's not always one structure. What matters is whiplash can be a multi-tissue injury, and the symptoms you feel depend on which tissues were stressed and how sensitive they become. Here's a big reason people get confused. Symptoms don't always show up right away. It's common for neck pain, stiffness, or headaches to develop hours to days after an impact. One reason is that right after a stressful event, your body can be running on adrenaline and urgency. And then later, when inflammation, muscle guarding, and tissue irritation settle in, you notice it more. When pain doesn't always show up on imaging right away, this is another common frustration. Someone gets x-rays or a scan and they're told it looks normal, but they still hurt. Early imaging after a crash is often focused on ruling out serious problems like fractures or major instability, but many whiplash injuries involve soft tissues, and soft tissue damage can't often be seen on x-rays. Even when more advanced imaging like MRI is used, the findings can vary. Imaging can help in certain cases, especially when there are neurological signs, but it's also possible to have significant symptoms with limited imaging findings early on. That's why we combine history and exam appropriate imaging decisions instead of relying on one test to tell the whole story. Whiplash recovery, a useful way to think about it is in phases, because what you need early on is often different from what you need later. In the early phase, the priorities are safety and clarity. We screen for red flags, determine whether imaging is needed, establish what movements are tolerable, start with gentle motion and support. Most guidelines emphasize a positive, supportive approach and the practical importance of staying as active as you reasonably can, favoring active strategies over purely passive care. In the next phase, the goal usually shifts to reducing pain and inflammation, restoring normal range of motion, reducing sensitivity and muscle guarding, improving control and stability in the neck and upper back, returning to normal activities progressively. This is also where tracking change matters. A good plan measures progress, range of motion, functional limits, symptom behavior, and adjusts if improvement isn't happening. If symptoms linger, it doesn't mean you're broken, but it does mean we should reassess. Are there joint contributors like facet irritation? Is nerve irritation involved? Are headaches or concussion-like symptoms part of the picture? From there, the plan may become more individualized and multidisciplinary, still focused on function, measurable progress, and the least invasive options that fit your findings. Depending on your exam findings and where you are in recovery, supportive tools may be used. For example, some people use therapies aimed at calming irritated tissues to make movement more tolerable. So sometimes those injured tissues do create a lot of inflammation, and with that, it kind of restricts your movement. So what we do with the laser is kind of focus on an area to go ahead and bring more blood flow and tissue regeneration to that area to help you move better. In selected cases, decompression may be considered later in recovery when the pattern suggests a disc or nerve irritation and it's appropriate. So sometimes the injuries can be so severe where it actually does create some compression on a disc. So in order to relieve the compression and free up those nerves that are giving you some neurological deficits that we find in your exam, we would go ahead and use our non-surgical spinal decompression. But the order matters. Phase-based care helps avoid doing the right thing at the wrong time. If you're in the Chicago area and you want clarity on what's driving your symptoms, an evaluation can help us decide what's appropriate for you.